ganja,
pot, grass,
Kush,
dope,
hash, swag,
weed,
sticky.
marijuana.
Medical. That's the next word that could be used to refer to marijuana in Utah. The Utah Patients Coalition is gathering signatures statewide to place a new medical cannabis initiative on the ballot in 2018. The push is under a microscope by those who want more proof that it qualifies as a medical treatment for certain chronic disorders. Marijuana is still a federally controlled substance. Those in the licensed medical field are not so quick to declare it as a viable form of treatment, even for glaucoma.
More studies need to be done to determine which variety of plant, the processing techniques, and both the mode and frequency that the drug would need to take before it would be a viable option for glaucoma management.
It's estimated that 6 people die each week of opioid drug overdoses in the state of Utah. Utah Senator Orrin Hatch is one lawmaker asking for more research into non-narcotic solutions in dealing with pain.
Because Utahns have watched their family members, friends, and neighbors grapple with this epidemic, many are seeking non-narcotic alternatives that can help with pain. Medical marijuana is just one such alternative. And after careful, deliberative thought, I've concluded that it's an alternative worth pursuing.
Hatch is among those who wants to know more about medical marijuana. He's created the Meds Act, hoping to get some answers.
Compounds found in marijuana have shown promise for treating a wide range of diseases and disorders. But because of bureaucratic red tape and fear, there is a lack of sufficient evidence about the safety and efficacy of these compounds.
Currently, there are no federal quality control measures for marijuana grown for medicinal use. Prescribers don't have to meet guidelines for appropriate doses for safety. Hatch believes this lack of oversight puts American lives at risk. But it also takes the FDA about 7 years for a drug to reach approval for use due to regulatory hoops.
The Meds Act would encourage this research through reduced regulatory interference, and it would expand sources of research-grade marijuana with the assurance of a quality-controlled product. My proposal would also allow for the commercial production of drugs developed from marijuana once they have been approved by the FDA.
Senator Hatch is also among others who don't want to see his state go to pot when it comes to recreation.
So let me be clear. I'm still very much opposed to the legalization of recreational marijuana, but I strongly support research into the medicinal benefits of marijuana, and I remain committed to helping patients find the help they need, whether they suffer from cancer, severe seizures, or any other chronic disorder.
Smoking the drug, driving while under the influence, or use in all public places would be prohibited.
If it were to become legal, we would adjust our enforcement as necessary, but I think what people need to understand is just because marijuana may become legal, it doesn't mean it's completely legal with no strings attached.
Under the new Utah initiative, cannabis would be exempt from sales tax. Cardholders would not be able to obtain more than 2 ounces of cannabis or 10 grams of cannabidiol from a licensed dispensary during any 14-day period. There would be special zoning districts and dispensary regulations.
I'm fairly confident that someday, as a result of more research, that there will be a day that we'll find a route that marijuana can be used to treat glaucoma. Perhaps that's an eye drop or even a pill form.
Hatch hopes the Meds Act will allow only licensed professionals to prescribe and treat those patients in need using a non-combustive form of marijuana in a medical way that doesn't just turn a profit for dispensaries. In St. George, Melissa Anderson, CEC News.